Infantile colic, an introduction and the dysbiosis theory of infantile colic. So what is infantile colic? Well, essentially, infantile colic is broadly defined as persistent crying. And it usually begins at birth and stops around 4 months of age. So what causes infantile colic? So it's not really very clear what actually causes infantile colic, and there's a variety of theories that have been suggested for the cause of it. And these theories range from a whole range of theories, really. On one end, you've got people who think that maybe it's just an extreme variant of natural crying, that this is just a natural thing, particularly since it stops at 4 months of age, I guess. However, a lot of authors sort of think that it might have intestinal causes, a lot of gas in the intestines or something like that, that might actually be causing this distress, which is causing this absolutely persistent and quite alarming crying in infants. So looking closer at one of the potential causes of some sort of intestinal dysfunction which could cause the colic is this theory of dysbiosis, where the actual intestinal bacteria in the infants isn't quite right. And a recent study has found that infants suffering from colic actually have a delayed development of the gastrointestinal flora, including absence of butyrate-producing species, which this was a very interesting study because basically what they did was that they measured the microbiota of control infants, of infants who don't suffer from colic and infants who do suffer from colic. And they found that there was that difference, and the differences evaporated around 4 to 6 months of age, which does suggest that there is some sort of delayed development of the intestinal bacteria, and this could very well be one of the important causes of colic. And this is actually quite beautiful because it sort of fits well alongside the literature, suggesting that the infantile colic is relieved by probiotics. And one of the causes of why this dysbiosis would cause colic is because it is believed to cause inflammation, which causes the pain. We'll look in a second at the potential causes of the gases by the dysbiosis. Looking at the butyrate-producing species as well, things such as Saccharomyces boulardii can help produce butyrate, and so it could be a deficiency of certain of these types of species, and which could actually be relieved by supplementation of probiotics, of any number of probiotics, but including things like Saccharomyces boulardii. And looking at gas production and how dysbiosis may relate to gas production, incorporates FODMAPs, and essentially 2 unpublished studies from Monash University have found that a low FODMAP diet in the breastfeeding mothers of mothers who have infants with colic significantly reduced the symptoms of colic in their infants. And this is interesting because it does bring in dysbiosis, because if a baby has dysbiosis and they do consume certain FODMAP containing fibers, then obviously the gases that are produced from that can produce distress and discomfort. And contrasting it to an earlier study actually found that the days that mothers consumed fruits, their infant's colic was much worse, which again sort of relates to the FODMAPs concept, and maybe instead of making the mothers not eat fruit, or suggesting that the mothers stop eating so much fruit, maybe simply correcting the dysbiosis in the infant would be sufficient to help relieve that. We don't know for sure, but it's just a hypothesis. However, looking at the FODMAP diet or decreasing FODMAPs in infants and in breastfeeding mothers should be done with caution, because a FODMAP diet can impair the bifidobacterium species. However, so should really, when we're looking at a FODMAPs diet, as a short-term intervention, great, but perhaps more long-term, looking more at restoring the probiotics and well, I guess fixing the dysbiosis instead of sort of unnecessarily restricting the diet of the mothers and the infants. So finally, although the probiotic theory of colic, or the dysbiosis theory of colic, is only one amongst many competing theories, it is quite a compelling theory, and it's great because there's very simple dietary changes and supplementation that can be done to sort of rule out whether this dysbiosis is a cause of the infantile colic in your patients. Other questions are, why did the infant have a delay in the development of the intestinal microflora? And there's no quick and easy answer to that question, but it's certainly something to keep in mind as you help manage patients with or suffering from colic.